Okay, so hi everybody, and welcome to our final session of the Allied Health Expo. So I have with me Silas Pollard, who is with Headspace, and so Silas is going to have a talk to you about Headspace, and I'll essentially just hand over to you, Silas, and allow you to do that. So I'm just going to stop the share on my computer, and you now have the floor.
Okay, thanks Andrew. Hi everyone. I'm Silas from Headspace, Gosford and Lake Haven. We are under health, so we are hospice. Our lead agency is health. So that puts this Headspace Centre in a unique position. Some Headspace Centres around Australia are with NGOs or other organisations. We literally have to be within a health profession to get a job here. It's both frustrating and awesome because you can have a great health career and move around in other agencies and services that are health run. We are a mental health service. I'm aware that you know these things, so forgive me. We're a youth mental health service for ages between 12 and 25. We have the two centres, which is kind of unique. Normally you just, one organisation covers one centre at Headspace. We're both Lake Haven and Gosford because the coast is a big place and we have to try and cater for the different geographical areas. We are the mild to moderate side of things. So if you've got a moderate to severe level of mental health, Headspace wouldn't be your first point of call. If you have low to moderate, then yes, Headspace is the appropriate service. And of course, if someone's referred to Headspace, we're not going to turn them away. We'll make sure there's a warm referral to the appropriate service. Our staff mainly include of things that are relevant to you guys. We have OT, social workers, psychologists, nurses, dietitians, exercise coach, whatever they are. And we have, of course, GPs. We have 4 of those at the moment. And we're always looking for more, to be honest. So I'm grateful that I can be talking to you guys. Cutting straight to it, we often will advertise through Seek or through our website or through internal Central Coast Local Health District emails first, and then it'll extend. So we do take on, new graduating staff or, TAFE students. We take all sorts of uni students, but we also require that allied health staff have a governing body, that they're registered. So you might not be a full psychologist yet, we get that, but we would need you to be registered. And as far as the pathway for psychologists, you would need external supervision, and we wouldn't do that here. And I know we've got a ton of psychologists in that kind of early stages of their career. I know we've got a ton of social workers. There are not many in this audience today, but I secretly think that occupational therapists have it all figured out with their 4 years. I see all the social workers and psychologists going through their stuff, and it's a long journey, so hang in there. A typical day at Headspace is you're going to be looking at a wide range of issues. It could be relationship breakups, it could be grief and loss, anything. If it's causing stress and anxiety and depression, anxiety and depression being our main presenting issue, then you will be working with these guys. It's lovely to be able to make an impact in young people's lives and really change the trajectory of their future careers and whatever. We're funded, both sides of government have historically been happy to fork out the money. We don't tangle too much with NDIS or, it's really great that we've had funding. We appreciate that. I think it's a soft spot in many people's hearts. A lot of people have been affected by mental health issues with young people. We have some areas that we're trying to focus this on. We have people who help find jobs to young people. That's the IPS program. So we have 2 staff members who will literally engage in education training and what's the other word they use? Education training and whatever. They help them find a job. And who knew, but that helps your mental health one of the best ways you can imagine. A reason we wake up in the morning, have a shower, money in the bank, it's good news. We have our physical health, so our doctors and nurses will look at whatever physical health areas are going on, sexual health, employment, physical health, mental health. Our counsellors will be doing, often we use the Medicare model where we'll have a GP's referral to our mental health social workers or psychologists, and they'll do their 10 sessions. Sometimes these kids are only coming in for 3 appointments and then they're good. Admittedly, our wait times are too long, so you've got a bit of stress and pressure from, you know, a large volume of people trying to access a free service. And with limited staff and funds, but you know, wait time is okay with a mild to moderate mental health situation. I mean, we're not a crisis drop-in freak out centre. We're kind of make an appointment, take it slow. Community engagement side of things, we're doing a lot of work with high schools, so we will do as much as we can with high schools, especially on the coast. I don't think any high school hasn't had us. There's 1 or 2, but they have their own ways of dealing with things. So we will go and work with, for example, Brisbane Waters Secondary College. Last year we saw every class in the junior campus, where we provided a full class on what's mental health, what can we do about it, ways to get in early, what supports are out there. It's really good. So if, you know, young people and then mental health is of interest, we definitely you know, full steam ahead with that. We get to do fun things like go up to Baxter and work with the boys up there, the Juvenile Justice Detention Centre. We used to go to the music festival Mountain Sounds because we just wanted to have access to over 18-year-olds and say, hey, life's stressful. You know, talking to uni students, you know where it's at. We find that mental health isn't a topic that people want to talk about, so they'll be forced to come by their parent or their grandmother, carer, whatever. Then they come, they say there's nothing wrong, I don't want to talk. So a good youth-friendly, engaging kind of practice is kind of needed by all of the staff. We have, you know, really strict dress code where it's quite casual and warm. On interview panels, we like to have a young person there, and we like to, you know, let the young person ask some questions in the interview. It's quite funny. I help run the youth reference group, and it's great to see when young people will ask a doctor of however many years, you know, are they good at talking with young people? And sometimes people don't come to the interview prepared for a young person to say whatever they're saying. So as you can imagine, if we're going to work with young people, we need to be able to work with young people. And if young people don't think that whoever you are, if you're not engaging or whatever, then we will not be able to do the job, regardless of their skills in the profession. So often you'll see a young person sitting on an interview panel. So a hot tip would be to smile and talk to them just like everybody else on the panel, including the manager who's in the room behind me. Yeah, we want to know from the get-go that you're okay to talk to young people, which is really easy for most people. Some people would just don't have it. So definitely we would appeal to people who are engaging with young people and are passionate. The whole team, if I was to take the camera around the whole team, everybody is here because they are passionate about young people and do what they can do. I like to keep things pretty concise. That's in a nutshell what we do. I am aware that we do come across much higher needs than the mild to moderate mental health. You're going to come across quite severe situations, and we will refer to the mental health line and CAMS who are next door, and we know all those guys by name and we work closely with them. And often, as you can imagine, once a severe episode is finished, then the young person will come back here to Headspace. So you are working with people in the severe, the moderate to severe, but not while they're having a severe episode. You'll work with them on their recovery, and we all work together really well. A lot of staff start here at Headspace and then they'll leap onto the next thing. That's really common. It's a good kind of entry-level career pathway because typically that's just what happens here. Yeah, I think I've been doing it along the lines of what you guys are after. Do we have any questions for me?
Mute. Okay, sorry, can you hear me now? Yeah, we do have some questions. So we do have a question from John saying, do social workers also need external supervision?
Good point. No, with psychologists, we would, how it's kind of different. I would say the social work supervision would be done by a social worker within the health system. It's just once you're a registered whatever, I'm not a psychologist, what is it after your pathway? Whatever you are when you become a psychologist, then sure. But while you're gaining your provisional, whatever that first 2 years are, while you're gaining that, you need external. Social workers would just use the social workers we've got here. There's tons of them.
No, that's good. So thank you. That was from John. He says, thank you, Silas. Good to know. So the next question is, what is the role of a dietitian at Headspace? Great question.
We're kind of leaning towards a more metabolic kind of response to mental health in young people. Instead of a 14-year-old girl coming in, seeing the doctor and being given an anxiety tablet, we're all about exercise, diet, and looking at lifestyle. So the role of a dietitian would be to look at the young person's eating habits and provide some options and to model, what's good eating, and also working with clinicians, because most of the time when we're doing our intake assessment, the topic of food is brought up because we're asking everything, how's family, how's work, how's drugs, how's relationships, whatever. And while you're there, then and there, you'd want to be capitalising and saying, hey, maybe eating 12 Snickers and a bottle of Coke a day isn't the kind of thing we need to be doing. So yeah, just looking at meal plans like you would be doing within a doctor's EPC out in the community. You'd be doing similar things, but in a fun, real way, and working with the challenges of young people and cooking and dieting. Yeah.
Okay, a question from Gabby. So is a psychology degree enough to work at Headspace, or do you need any extra experience?
Yeah, if you had a psychology degree, that's more than enough to apply for the position and to be successful. I know probably 80% of the staff in the last 10 years have been in that kind of boat. So yeah, it's kind of a hard field to have experience already in. If you are good with young people and you have your psych degree, yeah, you'd be red hot.
Okay, so another here from, I think it's Chloe. You mentioned that it is a good entry-level job. Could you elaborate on that? Is there an example of a new grad program at Headspace? Do you have grad programs, I guess, is the question.
Because we're health, the answer is yes. You'd be looking at, it'd be competitive, but we definitely, I think there's 3 kind of examples right now of staff who have recently finished their degrees. We have 3 students currently. One's a master's student, one's a 3rd year social worker, one's a TAFE student. Yeah, we're open for business. It is competitive, but once you have your degree, make sure you're registered with APRA or AASW, etc. And then for the psychologists, gaining provisional, off-site supervision. Yeah.
Okay, so a question from, I've just got a student number here, but it says, I'm studying psychology at the moment, and I was wondering if I would still be able to work at Headspace while still studying.
Nah, because we're health, you need a health profession to do anything in health. If we were a Headspace, like of the other 100 Headspaces around Australia, probably. But no, for Gosford and Lake Haven, you'd need to be registered. And that's just the hoop of health. Yeah.
Okay, thank you for that. Is there anything specific in terms of selection criteria that you are looking for in an application?
Good question. Well, once you had your health degree behind you and you were registered, look, someone who's got any experience, whether it's youth work, homelessness, working in shelters, anything relevant to this kind of industry, then that shines. Or just working with young people in general, even if that was in a community, a voluntary kind of role. If you had experience with working with young people in programs or in anything youth-led, youth-related, then that would fare well. But as far as selection criteria, like it's all listed on the application. I was kind of more thinking sitting in front of the panel where we're like, what's the difference between someone with a degree and someone with a degree and experience? But as far as selection criteria, it's just health profession. If you've got that, you can apply.
Yeah, look, I might even add to that generally there's a number of transferable skills that you would have developed in all sorts of positions. So Silas has talked about the fact that, if you've done volunteer work, then those sort of things develop things like your communication skills, your teamwork skills, all these sort of skills are the, project management skills. So all these sort of things, interpersonal skills, which would be really important in this role. So all these important components that you don't necessarily develop at university, but you certainly do develop them when you're out in the field doing all sorts of different things. So we can help you with that. So if you do have a resume and you want someone to have a look at it, then certainly bring it into the careers office and we can go over it for you. We can also assist with job interview practice, so we can do a mock interview. We can assist with selection criteria. So as Silas said, there's usually some selection criteria attached to a job, but that's going to vary from one job to another. So there'll be some technical skills that you need to have for certain jobs, but there'll always be different skills that you can that you've developed, which are those transferable skills and employability skills. So please do use the careers office for that, to be able to develop that. So there is another question here. Is there anything specific in terms of, we spoke about that, and Silas has put down that they do advertise on Seek if you are looking for any particular roles. Another question, what roles do, now it says SW play at Headspace?
So Honestly, if somebody applies for a youth access team member, that's your general multidisciplinary team. So we don't care what you are. If you're a health professional, on that team, we literally have nurses, OTs, psychologists, social workers, and we see them all as the same. So you'll do intake phone call and kind of suss out what's going on. For the young person, book the appointment, and then a week or two later, you'll do the 1 hour appointment. The screens will be done. Are they in a domestic violence relationship? Are they suicidal? What are their pronouns? You do your kind of check out, and then social worker, OT, nurse, it doesn't matter. We're just a multidisciplinary team, and social worker would do everything. It's kind of weird for nurses to come from other areas of health to Headspace because we're kind of just like get the job done. We don't kind of pull back and say, oh, that's a social work job or that's a psychology job. We do definitely when it comes to like a dad's score testing, like the clinical psychs will do their thing, but there's a real general youth access team, and anybody on that team is doing the same role. And on top of what we just covered, you'd be doing a bit of brief intervention. So I'm a bit of both. I started with youth work. I did a 4-year psychology degree. I'm not much of a psychologist, it turns out. It wasn't my fit. But now I'm doing a qualifying for social work. I'm doing a master's online, so go all the students. But I've been here 5 years and everybody just does basically the same role in the youth access position. Yeah.
Okay, awesome. So thank you for clarifying that. Okay, does anybody have any other questions before we wind up? All right, it's looking rather silent out there. So, so look, I'd like to take this opportunity to thank Silas for coming in and presenting today. It certainly gives us a really good insight into your organisation and what you do, and what you're looking for in terms of staff and how people can essentially become a part of your organisation. So thank you very much for that. And thank you everybody for joining us this afternoon. This is our last session of the virtual Allied Health Expo. So hopefully you've had an opportunity to attend some of the sessions. What we will be doing, we've recorded everything. So if anybody wishes to watch any of the recordings from previously, they will be available on the website at newcastle.edu.au/allied-health-expo. So once again, thank you very much, everybody, and we'll see you next time. Thanks, Silas. Much appreciated.
Thanks, Andrew. See you, everyone.
Bye, everybody.